When was the last time you did absolutely nothing for 5 minutes and just breathed? That was the exercise given to some 600 Fraser Health staff as part of a study conducted over a 30-day period.
In 2019, our Leadership and Organization Development Department decided to launch an org-wide study to test our hypothesis of whether mindfulness training would improve workforce engagement. The mindfulness study for psychological health really came out of Fraser Health's commitment to have a workplace that's psychologically healthy and safe. And also Fraser Health's commitment to the national standard for psychological health and safety in the workplace. The national standard is a set of guidelines to really establish a system that can address as well as assess psychological factors impacting staff and medical staff's well-being at work. And so engagement is one of those critical factors. This study was one of the largest and most rigorously designed mindfulness intervention studies in a workplace context. Over 600 Fraser Health staff and medical staff participated in one of 3 cohorts. And what we were looking at from the research was cohorts around mindfulness training, breath work, and no intervention to see what the impact would be on engagement and well-being. And we saw clear benefits from both the mindfulness cohort as well as the breath work. So the mindfulness cohort had access to digital videos and mindfulness exercises that they could use 5 to 10 minutes per day. The program also allowed them to invite a buddy. It could be a family member, it could be a friend. It didn't have to be someone within Fraser Health. They could also participate in the training, which would allow them to both see what their experience was that day and send messages to each other. And then the idea was for them to take 5 to 10 minutes during their workday to access some of the videos and to practice some of the exercises.
A follow-up survey showed positive results. Participants in both the mindfulness training and breathwork group showed improvements in well-being, engagement, job satisfaction, performance, and less job burnout. Following the study, participants continued to voluntarily take short mindfulness practice breaks over several months. Some participants felt a continual increase in engagement of their work, a clear indication of the lasting impact mindfulness has on employee well-being.
We've had over 3,500 staff and medical staff participate in the digital mindfulness program that we offered as a part of the study. And then we've also seen teams and groups in some of our clinical settings and our non-clinical settings using mindfulness as a way to open meetings, or we're using them for our large organizational meetings. And we're really finding that people are asking for more. What we're looking at now is studying team mindfulness to try to understand, rather than just an individual impact, what's the impact on the team's productivity. So we're really excited about the opportunity of learning kind of what's the same and what's different about an individual practice versus a team practice.
Programs like mindfulness training are one of the ways Fraser Health is creating a workplace where team members are supported in taking care of their personal psychological health and well-being. Given the profound impact of employee and medical staff well-being on the quality of care and patient experience, attending to psychosocial factors is critical to the long-term health and viability of our healthcare system. For pioneering psychological health and safety programming in the workplace, the Gold Apple in Workplace Health Innovation is awarded to Fraser Health's Mindfulness for Psychological Health study. Generously sponsored by Roper Grail LLP.